Hi, I'm Patricia Greenberg, and my guest today is Dr. John Fogarty. He's a physician in pulmonary critical care and sleep disorders medicine at Physicians East and Vidant Medical Center in Greenville, North Carolina. He also serves on the faculty at the Brody School of Medicine and East Carolina University and has repeatedly been recognized for excellence in teaching and training of pulmonary and critical care fellows. Welcome, John.
Thank you so much, Patricia. It's delightful to be here with you.
So, your expertise is in sleep medicine. Let's talk about sleep. And I know this sounds kind of funny, but what is sleep and why do we need it?
Yeah, those what is questions seem big
Yes.
these days, but for sleep, it's a great question because people have often struggled with that. For a long time, it was thought just to be some sort of passive kind of go rest sort of thing. And it turns out sleep is this very robust process we go through every night or every day, depending on our schedule. But sleep is probably one of the most crucial things we can do in terms of um, developing and maintaining learning, memory, so many of our body systems, cardiovascular, immune function, um, so many of our basic levels of functioning. And so, when we sleep, we basically kind of fall into a state of lack of awareness of everything around us. And then there's been an incredible amount of work into looking at what happens when we're really in that state.
Now, we often talk about how much is enough. I have so many questions about it because we know now how critical it is. Is it 8 hours a night? Is it 10 hours? Is it whatever your body allows?
And it's somewhat age dependent.
Okay.
So if we start in the beginning, so if we look at say infants up into early elementary school, maybe we're talking, especially young children, maybe, oh gosh, 14, 16 hours. Get towards elementary school, it might be mm, 12, 13 hours. Once you get into a little further along, teenagers are still in the range of 9 to 10 is what's the most appropriate, and thought to be as far as, really rejuvenating themselves, which makes you wonder, because if you have to get up at 7 a.m. for school, there's not a whole lot of kids going to bed at 9:30 or anything like that.
Oh,
They're
well,
just getting home from their events to start studying. So, and then for adults, probably the healthiest is, if I had to give one number, 8, but 7 to 8 hours is thought to be right. And then there's really it's kind of a big bell curve out there. And that's a lot of that is influenced some by genetics, so much by our surroundings and our activities and the habits we develop. So, but for adults, probably 8 hours is the right number, 7 or 8 hours. So that's thought to be the right amount. And obviously, some are less and some are more.
I am going to veer off for just a second because I want to ask when we need sleep, we've all experienced this. You have those nights where you just cannot fall asleep, or you're fighting sleep because you're engaged in whether it's a work deadline or you're at an event that's running late and you're just doing one of those, trying to keep your eyes open,
Yeah.
but your body really wants you to go to sleep. So I'd imagine that is, at what point does the body say, too bad, I'm going to sleep?
Yeah, that really hits the nail on the head in terms of really what controls our sleep.
Right.
And so there's probably two main forces out there that do that. One would be, we'll call it circadian rhythm. And so we'll base that on the sun. And late in the day, the sun goes down and this whole process occurs. Our brain releases some melatonin, and that kind of sets the stage for other things to happen. But that helps us to become kind of less alert, less awake, and more accepting of sleep. Just a word about the melatonin.
Okay.
The studies, it hasn't turned out to really be a great sleep medicine.
Mm.
This organization, the American Academy of Sleep Medicine, who are all the gurus and all, they suggest against that for sleep. So, you have a $1 billion industry, not really regulated. It's a huge world out there, especially kids. And there are kids who've been overdosed on melatonin because it's really, 3 milligrams might be 30 milligrams, things like that. So jet lag, it seems to work for,
Mhm.
maybe a rare REM behavior disorder, but for general sleep, melatonin is not looked at as a great option. And also it's not right at the time of bed. People who use it would use it a couple hours before bed. But getting back on track, so our circadian rhythm, at night, that really is giving us a signal that time to go to sleep. Yet if someone stays up through those signals, all of a sudden the sun comes up. We've heard of that, feel
Mhm.
that second wind.
Right.
So the circadian rhythm at that point would be telling us, hey, we're okay now, let's stay awake. But the second system that kicks into gear, people have used the term sleep pressure.
Okay.
And there have been some very specific chemicals identified. Glutamate is one of them. But basically, the idea of sleep pressure is that it just continues to build over time. And probably we're really vulnerable, especially when we go past our sleep time and through the course of the night. So when this really builds, there are different circumstances that can really be a problem because it's been well demonstrated. People can experience, we'll call it micro sleeps, just like 2 seconds, 3 seconds, and you
Right.
almost don't even close your eyes during that. Now, if you're sitting in a meeting, okay. If you're driving 70 down the highway, you can actually cover a pretty good distance in 2 or 3 seconds. So that can be an issue. And then when we think about that state of our brain craving sleep, it's not a good milieu to say be trying to learn or engage with
Right.
people or anything like that. So, for example, in my industry in medicine, they've kind of gotten rid of the idea of stay awake for 36 hours to show that you're mature and strong and all that. And it was realized huge amounts of errors and all that occur with that sleep deprivation.
So, Dr.
So
Fogarty, let me ask you a really important thing about that. So, we're in a society where the lights are on 24 hours a day. The phone, in fact, um, my daughter falls asleep with all the lights on. And so tell me about, I think we'll get into sleep hygiene in a little bit, but if the world is turning, the sun is going down, that is a natural God-given signal that we should be winding down. Yet most people fight that between the phone and staying up late. So what are you doing to the body? What is the long-term ramification of that? Because that's sleep deprivation.
yeah, and so it's almost doing so, and especially probably gaming at night might be one of the biggest things, because aside from just passive reading, it really is a very engaged kind of experience. So there's a lot that's been studied and written about the direct light exposure to our eyes, and how that can actually uh, undo that whole melatonin circadian rhythm process. So it's almost like that sort of goes away or at least becomes less strong of a signal. And in the world of chronic insomnia, can't get to sleep, can't stay asleep, paying attention to our signals is important. So in the world of, you mentioned the sleep hygiene, it's like try to eliminate as many possible things from the bedroom as far as lights as you can. Want a cool, dark, quiet, uninterrupted place, but mainly those will skew actual chemical changes in our brain to limit the effectiveness of that whole circadian rhythm problem. And maybe all of a sudden our brain thinks that 3 a.m. is 3 p.m. and some confusion that we don't know how it got there. Yeah.
So, this show is devoted to aging well, and I know that this is an issue for people of all ages. But of course, as we age, we all know this that if you're not taking care of yourself on every level, accelerates the aging process and potentially could bring upon disease. I know it's not that black and white, but it happens. If you have bad bedtime habits and you're switching it, can you get better at any age? Can you improve the responses that your body has to nighttime really at any point? Is
So
it all reversible, I guess is what I'm asking?
yeah, and I think as long as people have appropriate expectations, there can be dramatic changes that are had. The things that I see probably create the most havoc with, good sleep. Sometimes maybe the most common might be mental health issues, anxiety and depression. Some might be physical problems, whether it's sleep breathing problems, the whole apnea problem, whether it's more severe chronic pain can be a big player. So any of these things that really can just leave us in a disrupted state, play a big role. Allow me to take just a moment. So when we sleep, we know it's not all the same thing during the night. And so can almost divide the night in half, and that the second half of the night would represent our dream sleep, REM
Mhm.
sleep. When we're in that stage of sleep, our body is actually paralyzed almost from the neck down, except for breathing muscles. Our brain is active. It actually looks like it's awake. So when we do, fancy brain scans, it's like we're hot. The brain is going.
Wow.
That's when our dreaming is going on and all. Um, but I'm going to switch to the first half of the night when we're in that. So REM sleep, rapid eye movement, that's our dream sleep. So the first half would be, we'll call it, someone came up with the bright idea of non-REM sleep.
Okay.
So you could call your child not Jill or something,
Yeah.
but anyway, non-REM sleep. And non-REM sleep has a kind of a light and a deep phase. And the light phase, we spend about maybe half our night in that light phase. The deep phase of non-REM sleep during the first half of the night might represent 10 or 15% of our night, but it is probably it's the gold for our sleep, really. And what happens, um, there is like so many things that go on, and some of it has a lot of it's in the last 5 to 10 years, really interesting research in the world of neurology, neuroanatomy, neurophysiology. So one of the things that goes on, they've actually discovered a whole new kind of system in our brain called a glymphatic system.
Hmm.
And so these glymph cells, turns out we have more of them than we do neurons in our brain. That in that actual stage of deep non-REM sleep, they actually shrink by about 20-30%. And this opens up channels. So when we're in, and that actually allows us to eliminate metabolic byproducts from our brain. So that short period of sleep, our brain actually changes its structure a little bit. Also during that, I'm going to focus really on aging now, because
Okay.
during that phase of sleep, um, we take our experiences and that's when we actually make, create, and store our new memories. So, for example, we're engaging in this process today. And tonight, hopefully, at least one of us, when we get into our deep non-REM sleep, will take this as a little packet and send it up from a short-term storage in our brain. It's called the hippocampus, but that doesn't matter.
Mhm.
And put it up into our cortex, we'll think of as the long-term storage. So some people have used the example of like a USB port into the hard drive,
Okay.
and that it can only hold so much. And after a while, it just kind of gets wigged out. But um, so without that deep non-REM sleep, it doesn't mean that these packets don't go up there, but they go up there less complete, less, maybe less accurate, less frequently. And it's thought that there can be a 30, 40, 45% decline in ability to create new memories if we're missing that deep non-REM sleep. So this has really been looked at hard in situations of memory loss, and there's some fascinating studies that have taken people, call it early onset dementia, memory loss, and they've gotten into some wild, kind of invasive deep brain stimulation with ultrasound to try to prolong the what are called deep or delta waves that go on in these in that stage of sleep. And they've actually been able to, by prolonging these and increasing the amount of that, reverse memory loss in people.
Wow.
So these have been pretty small studies, hard to do, invasive. And the technique is probably not applicable to whole populations. But once you get mechanisms down, then, all kinds of smart people can then go after that to come up with, okay, let's find ways to work on this. So it brings into play this term neuroplasticity.
Hmm.
And probably when you and I were at an age of high school and college, it was thought, okay, you have so many brain cells and
Right.
you only lose them.
Yeah.
And it turns out that, so in the world of neuroplasticity, it refers to maintaining brain cells, improving the integrity of brain cells, and even making new brain cells. And so literature recently suggests in the more neuroplastic people, if you will, you can do this up to at least, it's been studied into our 80s. So,
Wow.
so all these different techniques, and most of that what's been recommended with that is along the lines of, healthy living, eat well, everything that you
Yeah,
espouse
yeah,
on your show.
yeah.
But focusing in also on the things that can help sleep. As an
So,
aside, if I could just mention as an
yes,
aside,
please, absolutely.
so one thing, an interesting outcropping from this has been just in the insomnia world and use of sleep medicines, because this is in
I was
um,
just,
I'll
that was my next question. I'm glad you're bringing it
Okay,
up. Yeah.
great.
Hmm.
So in the world of sleep medicine, like 3 years ago, a study came out that if you take Ambien 10 milligrams every day for more than 3 or 4 years, cardiovascular deaths go up.
Okay.
And that got a lot of scrutiny in the medical field. And it was kind of what we'll call an observational study. So the really good ones are prospective, randomized, and it kind of looked back at people. So, and people always are like, well, how could that possibly be anyway? But as far as a potential mechanism, it turns out that those sorts of medicines, and I don't want to pick on just one, but those sorts of medicines perhaps get us to sleep and keep us asleep, but don't necessarily allow us to get into that deep delta sleep or not deep non-REM sleep. So if you take a population of 1 million people in that circumstance, and I'll mention also during that deep non-REM sleep, we have a big area I left out, stabilization of cardiovascular function, like a reset for the next day, immune function, metabolism. So it's our gut, our microbiome. So almost every organ in our body does a little bit of a reset at night. And so you take that away from 1 million people, and all of a sudden things are going to pop up, like more heart disease, more infections, susceptibility to other problems, neurologic problems, memory problems, all of that.
So
So
essentially, John, you're taking a pill to sleep and you're sleeping, but your body's reacting as if it's in sleep deprivation.
or at least, sleep deprivation makes me think of no sleep. So you're getting
Right.
sleep, but not the good sleep.
Not the good
Yeah.
sleep, right. Right.
Yeah. So I guess it
And
comes in
I think
different
it makes
ways.
you loopy the next day, right? I mean, it has
So a
a,
lot of people talk about feeling a little bit, groggy,
yeah.
drugged, yeah, that
Hmm.
kind of thing.
Right.
So it'll be interesting to see the next few years with, understand these mechanisms better. Where does that take us?
John, I want to discuss the sleep-related breathing disorders, most notably the sleep apnea, which it's rampant now. I'm hearing so many. What is it? Why do we have it? What do we do about it? I know it's a
Yeah,
big question, but
yeah. And
yeah,
why so much more now than, you
right,
know,
right.
So sleep apnea, the words mean to stop breathing during sleep. And if we were going to just define what is apnea, it refers to 10 seconds or more of either no airflow in our throat, or significantly reduced airflow. And that's usually associated with an arousal or a disruption of sleep. So rather than light sleep, deep sleep, it's just light sleep the whole night long. So sleep apnea is like anxiety and depression or chronic pain or some other things, keeps us from getting into that deep, restful sleep. Now, about early in my training, probably, I won't say how long ago, but early in my training 30 years ago, um, it was questioned whether this really is important. Is it just a little sleep disruption? But over the years, it's been pretty well established that mild sleep apnea creates, I'll say, uh, not necessarily specific health issues, but people have identified it, related it to long-term studies, depression, job loss, relationship failure. Going through life not engaged is kind
Right.
of what a lot of people end up doing with this, just exhausted. When it's more severe, and the severity is usually based on how many apneas and oxygen changes and all this, but when it's in the more severe range, that's where we hear of it related to, say, blood pressure, blood sugar, strokes, atrial fibrillation, all that. For all of those, though, I guess the emphasis really is for all of those, that it's been recognized that treating the apnea pretty soon takes it back to a state of uh, almost like no apnea. So it's basically eliminates the fuel for the fire. And for example, even our blood vessels in people with like narrowed carotid arteries, they use treatment for CPAP, the carotid arteries open up some.
Okay.
There's all kinds of different things that have shown that. So mild apnea, it seems to be an impact on really on how we feel and not getting rested and all the impacts of that. And when it's more severe, it's that plus those circulation and metabolic problems and all.
So sleep apnea can be anatomical, it can be weight, it can be what are the causes of sleep apnea?
Yeah, that's a great question, and I don't think it's been completely established to this point, but it relates to a relaxation in our airway of the airway muscles, and so almost as if when people are asleep with apnea, so they have an excessive relaxation. It can be from the tongue base, from the airways, but if you think of sucking in through a flexible straw, so that's the collapse. Snoring would just be a vibration of those tissues. But so that collapse is what creates the obstruction. So generally obstructive sleep apnea is what we're talking about.
Right.
There's a less frequent sleep apnea that comes from, I think of this as can't breathe, won't breathe. And so narcotics would be won't breathe.
Okay.
We just kind of stop, and maybe a little more relaxation of the airway
Okay.
too. So it's one thing that's changed. If we, the sleep apnea prevalence, or I'll say the occurrence of apnea, there may be a little bit inherited because just weight does not necessarily cause apnea. There's lots of thin people with apnea. There's a lot of racial differences, and whether it's and so apnea is really down here. It's
Hmm.
not a sinus problem or
Okay.
anything like that. So it's down here, although obstruction of the upper airway can limit airflow and things like that. So if you improve that downstream, things get a little better. But treatments really are focused on whatever can fix the upper airway. So
So, another question I have for you is why does stress and anxiety affect our ability to sleep peacefully? Because here's where I feel the disconnect. Um, my new thing now is instead of aging gracefully, it's aging peacefully.
okay.
That our lives are quiet and calm, and we wind down at night when we want to go to sleep, or when we're done with our work day, leave it behind you. When you're with your friends, you're fully present with your friends and family. This is how we're going to get to old age in peace. Gracefully is maybe you want to have some decorum and still be pulled together and all that, but just really that you are not freaking out late in life. It's not healthy. It's not healthy when you're 20. It's certainly not healthy when you're 80. So how and why does stress affect our ability to fall asleep and to be relaxed and get ourselves, because we know stress is not just the physical and the external coming at us. When we're stressed out, we don't eat well and we don't exercise and our bodies are rigid. There's just so many unfortunate repercussions of it that don't allow you to sleep. What is it?
Sure.
Yeah, what is physiologically the stress doing to prevent your sleep?
Right. And I'm not sure if we're in a chicken or the egg world here, because it's
Yeah.
been always been a hard one to sort out. But I think one of the big things is sort of, if you will allow me, an agitated state or someone in a state of high anxiety. There's probably a higher level of what we'll call stress hormones.
Okay.
Cortisol is one, and another one would be norepinephrine. So these are things that would be more averse to sleep when they're in higher amounts. Now, someone with the awareness that you're talking about probably has a better shot at a good night's sleep than someone without that. Um, and so when we see people in the circumstance of I can't get to sleep or stay asleep, and if we exclude, the health issues and breathing problems and all that, look at medication effects. A lot of it comes back to, okay, let's lay a foundation of, healthy sleep. And probably the thing that's risen to the top there is same time to bed and same time out of bed in the morning. So even something like weekend fluctuations of more than an hour probably can throw that out of kilter for many nights. So probably the most important is trying to maintain those hours, which is not easy in a social world. Um, Healthy eating, not eating too late. Exercise is great, but not too late. Although I think late exercise is better than no exercise, but
Right, that's
not too
true.
late. And that specifically what it does is raise our body temperature. So our body, likes to be on the cooler side. So if when we're sleeping, so um, if we just exercise, we still have a higher body temperature, then that's not a prize for good sleep.
What's
When
the
we
range there? You want a 2 hour window, 4 hour window?
I think that's fair. Yes. So a few different, and I'm starting to think about alcohol and caffeine too.
Right. Mm-hmm.
So for exercise, I think at least 2 hours.
Hmm.
Um, Caffeine has about a half-life of about 8 hours. So probably you want to be before 2 p.m., noon. That would maybe make that the last time. It's interesting with caffeine. A 12-ounce Pepsi has about 50 milligrams of caffeine, and two Notos, I think, has about 200. And I think the Venti latte
Yeah.
is about 440. So that's almost 10 Cokes. So when you see people lined up, it's really the
Yeah.
pharmacologic effect of what's going on there. So
Absolutely.
yeah,
Absolutely.
but it works for sure. It'll keep those micro sleeps from happening. So, but for quality sleep at night, so and a word on alcohol, um, which may be America's most used sleep medicine. I don't know. So alcohol, the first few hours of sleep after, and I'm not talking about one drink, we're talking about two plus.
Okay.
And so two plus drinks, we'll probably be looking at um, the first 2 to 3 hours being sort of like a pass out sleep. And then everything after that being sort of a withdrawal sleep. So it doesn't, so that's, that fatigue in the morning that I've heard people experience that comes from that poor quality and just kind of a withdrawal sleep that goes on. So alcohol also maybe gets you to sleep, but it's not a great quality sleep. So, and then
Now, but
medications, we talked about, there's a lot of medications for illnesses that can impact on sleep, certainly too.
so we have women more than men, of course, because of menopause, have the issue of it feels like just one day you wake up in the middle of the night and you're wide awake from 12 midnight till 4 in the morning, and then absolutely exhausted the rest of the day. And that's a long trajectory through menopause to have that happen.
Right.
So I think we all that go through it say there's nothing we've tried everything. Everybody says they've tried everything. But I hope to think it's temporary for most people. Do you recommend a nap during the day if someone can manage that?
So in that kind of situation, so if you're going to do a nap is fine to do. A nap of longer than an hour may start impacting on the nighttime. Probably
Okay.
want to get your nap done around 12 or 1 o'clock, not at 3 o'clock, because
Oh,
even
interesting.
by then,
Okay.
yeah. And but really what to do about that 2 a.m., 3 a.m. thing. And so there have been a lot of studies that have compared medication to other techniques. And the other technique that really has risen to the top, it's in the world of psychology, and it would be cognitive behavioral therapy for insomnia. So studies that have looked at that, generally they look at two things most important. How quickly can you get to sleep, and how long do you sleep for? And often they'll study at time zero and come back in a year and maybe could compare the cognitive behavioral therapy, CBT, if you will, to the medication, and the CBT always wins. And
Interesting.
so the general idea of that, it builds on some of those sleep hygiene things. Some call it a toolbox for, how to sleep and all. And so there's a number of probably the optimum thing would be 3 to 6 sessions with a therapist, but there's a whole bunch of online things now available as well, resources that are out there. So that would probably be the resource I would go to,
Okay.
hoping to avoid medication, but looking up cognitive behavioral therapy for sleep, and seeing if these tools, and not laying in the bed for all that. If you're 20 or 30 minutes in the bed and it's not happening, get up out of the bed, maybe sit in a chair next to the bed. A light is going to be behind you, not in your face. It's interesting with light because it's been talked about, certain devices that have that light really change things. Maybe the Kindle, the softer back is a little better, light behind, soft light going behind us. There's so many things about light that can have an impact. Some people just get up and do mindless tasks, whether it's laundry or
Mhm.
cleaning or
Mhm.
whatever, but you start get that whole physical thing going, and maybe that's not the best, but light reading, non-disruptive things. You don't want to turn on the news or anything like that. So
I'm still a huge advocate of reading in bed because and books. I tell people read a real book because that will help you sleep. When you're fooling around with your device, even if you're reading, you have light coming at you. It's artificial. Even if it's a newspaper or a magazine, just getting off those electronics and getting that light out of your face.
sure, it could make a huge difference, and I think that's a great suggestion.
So Dr. Fogarty, you worked with active duty Marines for sleep disorders at the Cherry Point Naval Air Station. In your bio, I looked that up. What was the common source for that in young, healthy, highly active, fit adults? I mean, why was they having so much trouble sleeping?
So it's a great question, and it was generally two different groups of problems that seem to be occurring. Because really, you're taking, let's say most of them were 20 to 32 years old, and we're talking about, the most physically fit people
Yes.
out there. And they're always monitored for, everything they're doing. And so even all their wake hours and their sleep and everything is constantly monitored. So this is a group under intense scrutiny. Um, so unfortunately, a big part of this crew, this was probably 2005 to 13 or 14 in that range. And so a
Wow.
lot of these were people that actually returned from Iraq, Afghanistan, gotten blown up, and like their brain was not the same.
Okay.
And so it created this condition, almost narcolepsy like. And there's other circumstances where it happens. So in medicine, if you're not sure about, exactly what something is, you try to give it a pretty big name. So the term used was idiopathic hypersomnia,
Oh,
or we don't know why there's excessive sleepiness. And we have a bunch of categories of idiopathic hypersomnia. But why it happened in this crew, okay, trauma can do it, but a lot of these Marines seem to have it without the trauma. And so the military is doing some studies on that. Some have suggested perhaps, they get vaccines for 100 things, not 100,
yeah.
but
Yeah.
incredible amounts. Could anything there do it?
Right.
And if there's one, which one? Some have suggested, just an intense stress reaction because, gosh, they have that.
Sure.
But for that crowd, that's not completely known. Then a surprising thing is frequency of apnea in this crowd. And you're talking about healthy guys,
Yeah.
but maybe a bunch of these are healthy guys with that thick neck, So if we think of football players or something like that, they've studied football teams and they seem to have a little more apnea, and it may just relate to that bulky neck, but I don't think the whole story is completed on that. And then maybe if you have, so maybe a little more alcohol at night, and some people can add to it, but we don't study it in those circumstances. There have been studies on effects of alcohol, but alcohol kind of can make everything worse, but that's not the crowd I'm specifically talking about. So,
Yeah, and the reason it caught my eye and why I brought it up is because they have very strict regimens, like you mentioned. Not only are they scrutinized 24 hours a day, they have a bedtime and they have a time that they wake up. And that's what we're told our whole lives. If you go to bed at 10 o'clock and you wake up at 8, you have sufficient sleep and you work throughout the day and you wind down and all these healthy sleep habits that we're taught. And yet you had this population. Um,
yeah.
it's a curious
So
thing with young
they call
people.
these guys the tip of the spear. And so when there's something happening, which way will you run? And they are running. And so they're also, a lot of their life is maybe high adrenaline.
Mm-hmm.
And maybe there's impacts of that as well, aside from the physical injury, the emotional trauma. So in the world of PTSD as well, there's an increase in sleep disorders that is still being sorted out. And I should have probably mentioned that's probably a big player in this crowd as well. There is wild studies going on now in the world of PTSD, not just for soldiers, but in lots of other people in
Mm-hmm.
terms of using things, plant-based things, even to try to recreate events and take them through that. And a recent short study from the VA had like higher than 50% resolution of complete resolution of
Really?
PTSD in three
Really?
to six sessions of 2 sessions with the medication and 3 to 6 sessions with a therapist walking through, identify the source. So that's going to be validated, or that's going to be attempted to be validated in a larger study, and we'll see where that goes. Yeah.
Maybe that'll help all of us sleep better because
So,
I don't mean
and
to
right.
lump us in with the whole world, but we've all had traumas in our lives. We all have things that make us lose sleep, I
Yeah.
guess is what I'm saying in our lives. And some of us it's chronic and some of us it's short term, but in any event, it's there. It's an interesting study. As a pulmonologist, you care for people with a variety of lung and respiratory problems. How does lung health affect our overall health? Because we were at
Well,
our
that's a
lungs, we
great
can't breathe.
question.
And I know that that's kind of it almost sounds like a stupid question, but
No,
we know the
yeah,
role
so
it
I'll
plays is bringing oxygen into our bodies and releasing the carbon dioxide, but it plays a much bigger role in the overall health.
And so in young people, probably the most common problem young people have, say, would be asthma. And we're talking about perhaps 10% of the population. Now, more asthma would be mild than severe,
Hmm.
but it can be limiting in terms of whether it's performance on physical activity versus even in school performance is lowered, missed days, all kinds of things related to that. Over the years, if there's, the most frequent issue would be, say, smoking, but smoking has really there, I got to say, from I think when I around 1990, about 30% of Americans smoked, and I think that number is down to 15% now.
Wow.
So that's, improvement, and getting there. Um, it makes me think about the world of um, what's been touted as, and some people use successfully uh, to quit smoking in terms of vaping and things like that. But we've all read a lot about that probably in the world of Juul and the
Yes.
things that have come up related to that. And um, it turns out some of these are also sort of nicotine addiction machines
Mhm.
for teenagers. And the thing that's different in teenagers versus adults is they still have this, the brain is not even kind of in its stable place yet. And so when we talk about neuroplasticity is like a growing brain. And it turns out that the changes that, the high levels of nicotine that can be delivered um, in the vape devices can actually sort of rewire things and make these teenagers more vulnerable to other addictions, whether alcohol, drugs, cigarettes, whatever it might be. So it's this whole change in the way the brain develops that really has caught the eye of a lot of people and the scrutiny of a lot of people to try to limit that exposure in teens.
So let's translate that into an adult who still smokes, somebody who's elderly who still smokes. It's hard to believe that with all we know that people do, but they do. So quitting smoking, let's say in your 60s or 70s, can you reverse the damage that you've done?
So, and it depends. It's almost like what organ system we're talking about. So, the different kind of problems, probably the top three I would think about would be atherosclerosis that can affect heart, brain, and limbs, and then cancer, lung
Hmm.
cancer, bladder cancer, and then probably maybe COPD,
Right,
emphysema, that kind of thing.
right.
So, as far as atherosclerosis goes, whether it's heart attack or stroke or things like that, limiting future damage is the main thing there. I think
Right.
that's the most important thing. And outcomes are improved in people who are successful at quitting. In terms of cancers, one fascinating thing has happened with so over the last 7 years, um, 7 years ago, we had our first opportunity at lung cancer screening in people. So this became widely available, and for the first time in our country's history, the overall rate of cancer death has decreased just in the last year. And so lung cancer, more people die from that than breast cancer, prostate cancer, colon cancer, pancreatic cancer combined. So if you can impact the lung cancer death rate, you're gonna be able to push the needle a little bit.
Sure.
So just by quitting smoking and identifying cancers early, that's been a big player there. And in the world of lung related smoking problems, generally quitting might get your lungs a tiny bit better in terms of less infections and all. We don't improve breathing capacity too much, but cutting down on the rate of decline, it's really dramatic because if someone has moderate disease, say at age 55, uh, if they quit, they have a good shot at dying with that problem and not
Okay.
from that problem.
Okay.
So we really those early evaluations on people where they're coming in with some problem really uh, working hard on that to try to give their brain ammunition for why do I need to quit? Because just saying go quit, it just it's not so good. But and we're always in need of better tools to help.
Oh, yeah. I'm Patricia Greenberg, and we're talking about sleeping well, lung health, getting our bodies in good shape for our old age, and let's hope we all get to be 120 is my goal. My guest is Dr. John Fogarty. He's a pulmonologist based in Greenville, North Carolina. He specializes in sleep disorders, and he's revolutionizing the way we treat them. So let's go into that, John, now and talk about the treatments for sleep disorders.
Okay, great.
I think,
So,
I made a few notes, the BiPAP, CPAP, oral appliances, weight
yeah,
management, all of the
okay.
above. Yeah.
Sure. Okay. So when someone is found with, and specifically we're going to talk about sleep apnea for a few minutes. So we talked about this collapse of the airway and the kind of problems that that causes. So when we think about what can fix that, the approach is often, and I'm going to stick with adults right now because it's not always the same in
Yeah.
children
Right.
and adults, but I'll stick with adults. And we can taper the treatment or directly to the severity of the illness. So in mild sleep apnea, we're not preventing heart attacks. We're really addressing the disrupted sleep from all that heavy snoring. And by the way, that's often two people's disrupted sleep, not just
Yes.
one.
Yes.
So the two main, the different things that can happen. A lot of people notice they snore more on their back. So just a positional therapy can make a difference. Avoiding nighttime sedation, whether it's Valium or narcotics or alcohol, those things all will make it worse. And then when we get into actual other active therapies, we can think about a dental appliance. So if people's teeth are reasonably intact, an oral appliance can be made. It would be referred to as a mandibular advancement appliance.
Hmm.
So a dentist can create these, and generally, if you think of advancing the mandible forwards, it'll open up the back of the airway, so eliminate snoring, eliminate sleepiness, and again, maybe you get a twofer on that one in terms of
Yeah.
improved sleep.
Yeah.
But it turns out that in adults, the obstruction of the airway is often not just at the level of the mandible, but it can be further down in our throat. So that's where some maybe more significant interventions are needed. So continuous positive airway pressure, CPAP, it's been used for more than 30 years. It's kind of stood the test of time. It's a little bit of a clunky contraption, but it turns out um, for probably 2/3 of the people that use it, it's a really helpful, excellent intervention. They feel like their life is better with it than without it. Um, and it involves wearing some sort of interface, whether it's a cannula or in the nostrils or around the nose or nose and mouth, attached to a little compressor device that provides air pressure. And what it does is just keep the airway open and patent with that air pressure. So there are all kinds of different masks, machines. The pressure can be continuous. There are machines that can sense our airways in terms of if they're closing, they can increase the pressure and then
Okay.
back off when they're not. So that would be called an auto titrating machine. If people need really high levels of pressure, whether it's a really big neck or really severe apnea, um, a continuous pressure can get pretty hard to breathe out with. So then people get into this, you mentioned a BiPAP or bi-level
Right.
positive airway
Right.
pressure, where higher pressure in, so on the inspiratory phase, high pressure, and then it lets out when we breathe out. And then some people, even though the obstructive airway is fixed, they stop breathing. And that gets into, we'll call it a central or complex apnea. So some of these machines can even supply a backup rate and just breathe for us. And that, and in some circumstances, that can be helpful.
And is
So
that a
those,
lifelong, is that something one would have to
well,
wear for the rest of their lives?
if something else can change, for example, if in the world of really big people who go and lose 100 pounds, say with bariatric surgery, in my experience, about 50% of them have resolved apnea.
Wow.
50%, there's still some there, but maybe they can, downsize to just the appliance or whatever it might be. So, and that gets into, it's not just weight and fatty tissue that causes this, it's other things
Right.
too, some anatomic things and all that. CPAP doesn't do the trick for everybody. So you're left with, and also there's even some people who just stay sleepy despite that. So especially there's a lot of scrutiny, say on long haul drivers, that kind of thing, and they have to get squared away periodically on this sort of thing.
Hmm.
Um, so, so other, attempts have been made to try to come up with fixes. Over the years, a lot of different surgeries have been used. The most traditional surgery big long word, uvulopalato-pharyngoplasty. It involves removing a little bit of the back of the palate of the throat,
Mm.
take out the uvula that hangs down, tighten up the tissues, maybe even advance a bone a little bit, trying to create a tighter, bigger airway. Unfortunately, the track record with this over time is that a lot of people just kind of went back to where they were.
Right.
So it didn't have quite the success rate that's desired. There may be some people out there it's still the right thing for. There's a lot of kind of little surgeries that are sometimes done, but I'll say probably aren't mainstream.
How
A
how
newer
about the
therapy that's
removing the tonsils and the adenoids? Is there any
so
success with that or
so it's interesting with children because they have such tiny airways, just eliminating what might be a blockage of the tonsils and adenoids is all they need.
okay.
And so in children, that's a fix. When we get into adults, then that single level obstruction, just fixing that doesn't work. So in that big surgery, they would also take out the tonsils and adenoids if they're still there. But I think it just reflects there's more to it. And maybe it gets to this issue of either tongue base or muscles around the throat becoming too relaxed. So you just have a big airway with more relaxed muscles. So this is where a more recent device that's come out called Inspire, if you've heard of that. So
Mm-hmm.
this takes a different approach, and it looks at in a lot of people the base of the tongue collapsing into the airway when we breathe in, just filling in that space with where there's kind of a negative pressure. And so what's done is implanting. It's called a generator or pacemaker device, and they would usually put that on the right side of the chest. So we'll save that side for the heart, but
Right,
we'll put
right.
this one over here. And then what we'll do is have one lead go around the lung when that's put in, just to sense when we're breathing in and that sort of thing. And then another lead is inserted. Actually, it's put up in the neck. And this is usually done by ear, nose, and throat specialists. And they actually dissect out what's called the hypoglossal nerve, which feeds the tongue. Has a lot of branches, but if you get the right branches, it'll actually, when you stimulate it, advance the tongue forwards. So it's interesting. This is usually done, in at least what I've seen, more by the cancer ENT surgeons than anyone else because they're really comfortable with, dealing with these nerves, preserving nerves, and everything else. So it's kind of their sweet spot, if you will. So, but basically, you would go through a procedure to see will this work? Because when the devices came out 8 years or so ago, they were about 50% successful. And that still wasn't good enough. And the insurers and Medicare said, well, give us 80 or 90%. And so they went back and looked, and some people, the airway collapses, we'll call it concentrically, in which case Inspire doesn't work. And in some people, the tongue just
I
collapses,
see.
in
Hmm.
which case Inspire works. So in that crowd, they would get actually what's called a sleep endoscopy, where you'd actually go to like a little surgery center or somewhere and get put to sleep, look down with a light. How does your airway collapse? So if you have the more favorable collapse, well, the studies then showed got it up to 80 or 90% success. And
Wow.
so it's interesting because this then got approved and then the COVID hits. So, it kind of got put aside for a little while. But I think there's been over 5,000 people that have had this inserted now. So it's becoming a little bit more frequent procedure. It's a little expensive. The recommendations are moderate to severe apnea. So it wouldn't be done in someone who's mild.
Okay.
They aren't yet doing it in people who are, say, significantly overweight, but they go by body mass index, and below
Okay. Hmm.
35 is good.
Right.
Um, and that may change going forwards. So I've seen about 30 patients go through this process, and it's been, with all that kind of scrutiny beforehand, I'll say the results I've seen have been better than the studies. So maybe 28 out of 30 positive,
That's a
really
good track
successful
record, I
results.
think.
So
That's yeah. Hmm.
yeah, and obviously local, every locale may be a little different, but so that's another option out there for people. Um, they're actually doing some studies now. So that crowd that their throat collapses circumferentially, they're looking at stimulating different areas. So maybe in a couple of years, there'll be something available for them. Uh, there's always the tracheotomy. A hole in the throat can take care of business,
Yeah.
but
Yeah.
it's not not too many people want to go that way. So there's a few other things out there that are less mainstream and not used too much.
So, we're at time and there's just so much more to talk about. I wanted to also, just before we finish, restless leg syndrome seems to be very common among older people, and it keeps people up at night. Do you want to quickly address
Sure.
what it is and why it affects our sleep?
And for most people, and about 80% of people, it's probably an inherited disorder that shows up later in life. And the most common scenario would be people having to kind of shake out their legs in the evenings, in the hour or two before bedtime. All of a sudden, things get restless and it's uncomfortable, and at night. And sometimes they're not even aware of it at night, but it is usually disruptive of both their sleep, their spouse's sleep. So perhaps 10% of the population has some degree of this, but maybe 1 out of 10 of them needs something, 2 out of 10 maybe needs something done. So we're talking about 2 to 4% of the population maybe, but when you take everybody, that's a lot of people. So it turns out it relates to a very specific chemical pathway that's kind of brain spinal cord related. So in approaching that, the medications that are used for that go after that specific mechanism. So it's interesting. Iron, so we've heard, low iron, anemia, that kind of thing can be a player in this. So we usually recommend get that checked. So we see little increase in restless legs in pregnancy because sometimes there's a little low iron. But then when people are older, so if it's just a little low iron, take some iron. But if it's not the iron, then there's probably 4 or 5 different categories of medications that can be used to take care of that. And usually it's not a sleeping pill. It would be medicine that specifically addresses either that lack of the dopaminergic process in our spinal cords, or maybe something that is just overwhelms that and just quiets things down. But for most people, that can be sort of controlled with medication. And it's a hard one to measure because, how do you measure restless legs? So if someone has a formal sleep study in a lab, that's pretty easy. But in fact, if you get the history, you can just go ahead and it's recommended to just go ahead and treat that. So restless legs would not be a specific indication to go do a sleep test. And interestingly, it often runs with sleep apnea. Treat the apnea, the limbs improve. So
That's interesting.
so often before we start a long-term medicine, we'll see, well, let's see how this goes. And a lot of people don't see it as an issue anymore, but if it is, then we can address that. And really, it's lessening the sleepiness associated with due to the disrupted sleep from those restless legs.
Well, a lot to think about. I learned so much today. I always say I think I know all kinds of things until I have someone like you on and I learn a whole new wave of information. And
Right.
so in closing, thank you so much, Dr. John Fogarty, physician, educator, and expert on all things pulmonary critical care and sleep disorders medicine. Thank you so much for joining us and sharing such valuable information with our listeners. And of course, I want to know, John, what do you like about getting older?
What I like about getting older the most, I think, is worrying less about what other people think and just doing what I need to do.
There you go. There you go. That's the golden thing. Stop caring what anybody thinks. And thank you all for listening.